Okay, welcome back. So let's look at Cubital Fossa. Okay, so Cubital Fossa is one of the important zones of upper limb. If you come to important zones in the whole body, in upper limb we have a um, axilla, cubital fossa, and temporal lumbar, and we have done axilla. Then lower limb we have a femoral triangle, adductor canal, popliteal fossa. Then for head, we have pterygopontine fossa. For neck, we have triangles of the neck and posterior triangles of the neck. Then, if you come to abdomen, we have a inguinal canal. If you come to perineum, we have a sciatic fossa. So every important zone we use. I told you before we use definition slash location A, B, C, roof, and floor. So we talk about definition and location. Definition location as number one. And roof 2, floor 3, boundary 4, content 5, applied atom 6. So we're going to use this format and explain this. Could be something. So let's start. Number one, definition location. So we say that it was you will define using the shape. It is triangular shaped depression. So I say now I have defined it with the shape. Then let's now locate it. Located in front of anterior aspect, in front in front of the elbow. Then remember we said in definition location you can also include the importance of the space if you know it. So the importance is it is a common site. It's a common site for checking blood pressure and also for giving intravenous injection. We normally give injection in the anterior aspect of the mouth of the elbow, that is the cubital fossa. Then number two is what? Let's talk about the floor. So the floor is this, so the roof is this. So what can you see in the roof? The first thing I can see is I can see skin. If you remove the skin, you see superficial fascia. And this superficial fascia contains five things. Contain three veins, then three veins and two nerves. So let's say all this side is lateral, all this side is medial. So the vein you see on the lateral side is called cephalic vein. So then the vein you see on the medial side is basilic vein. Then this one you see on the joining the basilic and cephalic is a median cubital vein. Median cubital vein. Do you understand? Okay. Then what are the nerves that accompany these two veins? This one that accompanies cephalic vein is called lateral cutaneous nerve of forearm. While this one accompanying basilic vein is what? Median cutaneous nerve of forearm. Then after this, the roof is made up of skin, superficial fascia, and deep fascia. If you look at what we see in the superficial fascia, three veins, which are what? Cephalic vein laterally, basilic vein medially, median cubital vein joining both of them. Then the veins that are the nerves that accompany the two nerves are medial cutaneous nerve of arm and medial cutaneous nerve of forearm. Then the next after the skin superficial fascia, then the next one is for deep fascia, strengthened by strengthened by bicipital aponeurosis. Bicipital aponeurosis. So this is all you have to know about what the roof. Then let's look at now after the roof is now the floor. So the floor is formed by muscles, two muscles. The first one is brachialis. Brachialis is superficial. Then the second muscle is supinator. Supinator is deeply. Okay, so the floor is formed by two muscles. The floor is brachialis and supinator. So this one is superficial, this one is deep. Okay, then I think we are done with the floor. So the next thing is the boundaries. So let's look at the boundaries of this fossa. So the fossa is like this. So this side is lateral. So this side is medial. Then there is a bony prominence here, bony prominence here. This bony prominence is lateral epicondyle. This is medial epicondyle. Then then this lateral wall, this is there's a muscle like this. Then this one there's a muscle like this. So you see that this muscle, so this muscle is brachioradialis. Brachioradialis. Then this one is pronator teres. Pronator teres. Okay. Then are you seeing this is the apex of the sorry the base of the triangle? This is the apex. This is the medial lateral wall. This is the medial wall. So let's start with the what? The base. So what form the base? So the base is formed by what? The imaginary line. This is imaginary line. An imaginary line connecting the two humeral epicondyles. Then let's talk about the median one. I want to do the apex last. If you look at this, this is brachioradialis. You know, some of this side is lateral. So this is the lateral border of this muscle, the lateral border. Then this is the medial border. The same thing with this guy. This is its medial border, but this is medial side. Then this is lateral border. So I see, look at the fossa itself. This thing that I'm drawing like this, and this triangle. So remember, this is imaginary line, so that's why I use it like that. Okay. Then you now see that what actually formed the median wall of this muscle. This is the so if you come to the what the median wall, I've talked about the apex, sorry, the base. We want now talk about the walls. The median wall. Look at the median wall. The median wall, as you can see, the median wall, as you can see, is formed by what? Lateral border of pronator teres. While the lateral wall is formed by what? This is the lateral wall is formed by what? Medial border of this muscle. Medial border of brachioradialis. Brachioradialis. Okay. So I think we are done with the wall. So it's now remaining the apex. Then for the apex, you now see that what form the apex is what? Brachioradialis overlapping pronator teres. So are you seeing this muscle brachial overlapped pronator teres? Okay, I think we are done with the boundaries. We have talked about the base, the apex, and the two sides. Then the next thing is what? The content. So the content of cubital fossa, I'll say my buttocks turns red. This thing is from median to okay. Let's say small this side is lateral. Then this arrangement is from median to lateral, meaning that the most median is what? Median nerve, that is the M. Then followed by B is brachial artery. Then T is tendon of biceps. Then R is radial nerve and is posterior interosseous branch. So this is the from medial to lateral. Then I think we are done with the content, and the last is applied anatomy.